Morphine in bodybuilding, the classic opioid, training through pain, and dangerous dependence. Introduction. Morphine. The name alone carries weight. It's one of the oldest, most famous opioids, derived from the opium poppy, named after Morpheus, the Greek god of dreams. In hospitals, morphine is reserved for severe pain, cancer, post-surgery, or traumatic injury. But what happens when bodybuilders, always chasing the edge, encounter this powerful narcotic? Today we'll explore how morphine works, why some athletes misuse it, and the devastating risks when it collides with bodybuilding culture. How morphine works. Biochemistry. Morphine binds directly to mu-opioid receptors in the brain, spinal cord, and gut. This blocks pain signals and floods the brain's reward pathways with dopamine, creating both analgesia and euphoria. It also slows the locus coeruleus, norepinephrine center, reducing anxiety, but also depressing breathing. Half-life, 2 to 3 hours. But effects last longer, especially with sustained-release forms. Potency, 10 times stronger than codeine and more direct than tramadol. Why bodybuilders might use morphine. Training through injuries. Bodybuilding is brutal. Torn rotator cuffs, slipped discs, tendon tears. Morphine can mask pain so effectively that athletes return to training too soon, worsening long-term damage. Post-surgical recovery. After shoulder or knee surgery, morphine is often prescribed short-term. Some bodybuilders continue using it beyond the prescription. Mental escape. Contest prep brings stress, hunger, insomnia, and anxiety. Morphine provides temporary escape into calmness and euphoria. Extreme muscle pumps. Myth. Some users believe morphine enhances vascularity or pump due to histamine release. In reality, histamine release causes itching, flushing, and low blood pressure, not a real bodybuilding advantage. Dosage in medicine versus misuse. Medical dose. 5 to 30 milligrams oral immediate release every 4 hours. Sustained release tablets, MS content, 15 to 200 milligrams 1 to 2 times daily. IV morphine, 2 to 10 milligrams every few hours in hospital settings. Bodybuilding misuse. Some experiment with oral tablets pre- or post-training. Others escalate to high doses, chasing euphoria and pain relief. Risk. Tolerance builds quickly, leading to dependence. Risks and side effects in bodybuilding. Physical risks. Respiratory depression, the #1 killer in opioid overdoses. Severe dependence. Withdrawal is brutal. Sweating, cramps, anxiety, insomnia, and vomiting. Hormonal crash. Opioids reduce GnRH, LH, and testosterone, leading to muscle loss, sexual dysfunction, and poor recovery. Constipation, a constant issue for long-term users. Immune suppression, higher risk of infections. Liver and kidney stress, especially if mixed with acetaminophen or NSAIDs. Psychological risks. Euphoria to addiction cycle. Morphine's direct dopamine surge makes it highly addictive. Brain fog, reduced alertness, slower reaction time. Depression, long-term use can flatten mood when off drug. Dangerous interactions. Steroids, testosterone, trenbolone, opioid-induced testosterone low worsens recovery from steroid cycles. Clenbuterol, T3, both strain the heart. Morphine adds respiratory depression, creating deadly risk. Benzodiazepines, alcohol, sleep meds, combination equals overdose and death. NSAIDs, Some athletes combine morphine with ibuprofen, leading to gut bleeding and kidney damage. Statistical evidence. Studies show 70 to 90% of long-term opioid users develop hormonal suppression, or opioid-induced hypogonadism. In orthopedic rehab, athletes who continued morphine beyond 3 months had significantly worse recovery outcomes. Over 60% of opioid overdoses in Western countries involve morphine or its derivatives, oxycodone, hydromorphone, or heroin. Why is morphine especially dangerous in bodybuilding? Masks injuries. Pain is a signal. Morphine silences it. Training with masked pain to catastrophic injuries, tendon ruptures, herniated discs. Hormonal collapse. Even without steroids, morphine lowers testosterone. Combined with anabolic steroid shutdown equals double crash. Severe depression, no libido, muscle wasting. False recovery illusion. Athletes feel fine on morphine, but tissues aren't healing. Leads to chronic injuries that end careers. Addiction spiral. Starts medically after surgery, continues recreationally, dependence. Bodybuilding community already has high rates of polydrug use. Morphine adds another deadly layer. Final warning. Morphine is one of the most powerful painkillers in medicine, but in bodybuilding, it has no place. It doesn't build muscle, it doesn't help recovery. It only hides damage, lowers hormones, and risks addiction or death. For some, morphine begins as post-surgery relief, but ends in dependency, ruined health, and lost careers. The strongest opioid in the hospital is also one of the most destructive in the gym.